to see single payer in the state of Illinois. That is access to health care for everyone. And single payer we applaud to a certain degree what happened in Washington, D.C. But in the years that I've been in office, no one has ever come to me and said, Representative, I need access to an insurance company. They said, I need access to health care. Health care. If we had House Bill 311, we could negotiate the prices. If we had Health Care 311, we could bring down the prescription drugs. If we had House Bill 311, business people would be able to hire more people because they will have control over their costs. If we had House Bill 311, there would be fewer people going to the emergency room because all of them will have access to quality care. If we had House Bill 311, there would be fewer medical errors. There would be fewer never should have happened. The doctors of all people, doctors of the medical professional people would be in charge of your health care. We would not have to negotiate, which one do I pay? Do I pay my health insurance premium or do I pay my mortgage? Do I keep a roof over my head? But still, if you pay the premiums, once again, it does not give you access to the care. That's the problem. And you will be able to, you will be able to keep your own doctors. You will be able to choose your hospital that you want. There will be nothing, absolutely nothing, to come between you and your health care provider. So, I will have some of the professionals to speak a little further in regards to House Bill 311. Thank you very much.
Good afternoon. Again, I'm Claudia Lenhoff, Director of Champaign County Healthcare Consumers. And Healthcare Consumers is a grassroots consumer health advocacy organization founded in 1977, and we are a proud member of the Illinois Single Payer Coalition, and we've been for single payers since the beginning of our organization. We are very grateful to Representative Flowers and the other co-sponsors for supporting HB 311, and we want to do whatever we can to advance single payer health care in Illinois. We are intimately acquainted with the healthcare system and the problems that consumers face because we are on the front lines every day helping individuals and families navigate our broken system. Through our consumer health hotline, we work directly with people who are having problems with the healthcare system. We get calls from hundreds of consumers every month. Those who are uninsured call us seeking help in finding the health care they need but can't afford. Those who are insured call us frequently seeking help to battle their health insurance company's decisions to deny claims for the care that their doctors have ordered. Or they call us because despite having insurance, they are shocked to find out their coverage is not what they thought it was, and they are left with huge amounts of medical debt that threaten their financial lives and their ability to obtain more of the care that they need. Our nation's health care is in crisis. We know that. We have no system. We have no guarantee of the right to health care. If you can afford it, you can get it. If you can't afford it, you can't get it. It's that simple, and it's deeply tragic. We all know the statistics of the millions of uninsured and millions more underinsured. And we know that more than 45,000 people die each year simply because they lack health insurance. This means that they die needlessly, they live sicker than they had to be, they suffer more than necessary, and their lives are cut short too soon. To us at Healthcare Consumers, these are not just facts and numbers. We can tell you about individuals we've worked with who are some of the faces behind these numbers, and some are individuals whose lives and deaths we do grieve. We can tell you that the problem isn't just a lack of insurance, and it's not just the uninsured who suffer. There are plenty of people with private health insurance who are denied care at our local physician clinics because the clinics don't want their type of insurance, or because their insurance has left the patient owing too much money to the healthcare provider. And now we're getting to the heart of the problem that makes HB 311 so important, and why the Affordable Care Act is not the solution to our nation's healthcare problems. I want to talk a moment about private health insurance. But first of all, health insurance is supposed to do two things. It's supposed to guarantee access to health care when someone is sick or injured, and hopefully to preventive care as well. And two, it's supposed to protect people financially from the cost of that care. So we understand the problem of the uninsured. No insurance equals no access. But why are so many people uninsured? They are uninsured for the simple reason that they cannot afford health insurance. It is priced out of their reach. Premiums go up by double digits almost each year, far higher than the inflation rate. And why? Because insurance companies must generate a profit for their shareholders. The cost of our own small group health insurance plan has increased by more than 100% in 4 years. It is now, what we pay in health insurance premiums is now the equivalent of what we would pay for a staff member. No wonder we can't afford to expand our staff or give raises to staff and so on. And we're worrying now about what we're going to do next year. But affording health insurance is not the only problem that the insured are facing here in our state and around the nation. Over 75% of Illinois residents who had to file bankruptcy because of medical debt had health insurance at the time that they incurred that debt. People in our community with various types of private insurance are being denied care at local clinics because of medical debt. These are people who played by the rules. They got jobs that offer insurance. They purchased that insurance. They continue to pay for that insurance out of their paychecks each month, and yet they are no service because of outstanding medical debt that they are trying to pay off each month. Why do people with insurance owe so much money for their health care? The answer is simple. Private insurance is designed to have a high rate of product failure. Remember what insurance is supposed to do: give you access to health care and protect you from financial ruin. Health insurance that leaves you locked out and in debt is exhibiting symptoms of product failure. It's like an umbrella that melts in the rain. But this isn't an accident, and it is not an oversight of design. This is on purpose, and it is the result of an inherently flawed system. Private for-profit health insurance companies have an inherent conflict of interest. They have to generate profits every month for their shareholders, and that's who they're accountable to, not the consumer. So how do they make those profits? They enroll lots of people who pay monthly premiums that increase every year at a far greater rate than inflation. They use cost-shifting mechanisms where you pay more and more for your care and they pay less and less. And they work hard to find ways to not have to pay your medical claims. If they honor the bargain with you, the insured, they lose money and they violate the bargain with their shareholders. It is really as simple as that. Our state and nation solution to the healthcare crisis and the crisis of the uninsured cannot be that we simply provide more people with the same bad for-profit health insurance plans that are currently leaving thousands of Illinois and Champaign County residents in financial ruin and healthcare crisis. Unfortunately, that is the bulk of what the Affordable Care Act does, and that is why we in Illinois need to find a better solution. We at Healthcare Consumers believe that any state or national program to provide health insurance to the population must provide health insurance that truly guarantees access, truly protects people from financial debt and ruin, and it must be insurance that levels the playing field, that guarantees that all patients are treated fairly and equally, and that doesn't put healthcare providers in a position of seeing some insurance and patients as more desirable or less desirable than another. And HB 311, the Illinois Universal Health Care Act, is that solution. Thank you.